The intensive care unit, or ICU, is a place where the sickest patients fight for their lives. Some patients arrive unable to breathe on their own. For these patients, ventilators are a lifeline. A ventilator is a machine that breathes for a patient who cannot breathe on their own. It is a complex and powerful tool, capable of sustaining life when the body's own systems fail. In the ICU, ventilators are used for a variety of conditions, from severe pneumonia to traumatic brain injuries. Without ventilators, many of these patients would not survive. Ventilators work by delivering oxygen to the lungs and removing carbon dioxide from the body. They consist of a pump, a set of tubes, and a mask or tube that goes into the patient's airway. The ventilator pumps air, mixed with the right amount of oxygen, into the lungs. This helps the patient get the oxygen they need to survive. The decision to place a patient on a ventilator is not taken lightly. It is a serious intervention that carries its own set of risks and complications. However, for patients who cannot breathe on their own, a ventilator can mean the difference between life and death. The use of ventilators is a testament to the advancements in modern medicine. These machines are a vital tool in the fight to save lives in the ICU. To understand how a ventilator works, imagine a set of bellows gently inflating and deflating the lungs. This is essentially what a ventilator does, but with precise control over the volume, pressure, and rate of each breath. The process involves two key phases: inhalation and exhalation. During inhalation, the ventilator pushes a preset volume of air, enriched with oxygen, into the patient's lungs. This positive pressure inflates the lungs, much like a balloon, facilitating the exchange of oxygen and carbon dioxide in the tiny air sacs called alveoli. Exhalation, on the other hand, is a passive process. Once the set volume of air is delivered, the ventilator allows the lungs to recoil naturally, expelling the air containing carbon dioxide. This cycle of inhalation and exhalation continues, mimicking the body's natural breathing rhythm. The beauty of a ventilator lies in its ability to adjust the breathing parameters to meet the individual needs of each patient. Factors like the patient's size, underlying lung condition, and overall health status determine the settings used. Ventilators are not a one-size-fits-all solution. Different modes of ventilation are available, each with its own advantages and disadvantages. These modes offer varying levels of support, ranging from full ventilatory support to partial assistance, allowing clinicians to tailor the treatment to the patient's specific needs. Choosing the right type of ventilation is like selecting the right tool for a job. Just as a carpenter wouldn't use a hammer for every task, doctors select the ventilation mode that best suits the patient's condition and needs. Let's explore some common types of ventilation volume-controlled ventilation, or VCV. In this mode, the ventilator delivers a fixed volume of air with each breath. It's like filling a glass to a specific mark. The volume is consistent regardless of the pressure required. VCV is often used in patients who need full breathing support. Pressure-controlled ventilation, or PCV. Here, the ventilator delivers air at a constant pressure. This means the volume of air delivered with each breath can vary depending on the resistance in the lungs. Imagine inflating a balloon. The pressure remains constant, but the volume changes as it inflates. PCV can be gentler on the lungs and is often preferred for patients with sensitive airways. Assist control ventilation, or ACV. This mode combines aspects of both VCV and PCV. The ventilator delivers breaths at a set rate and volume, but the patient can also trigger breaths on their own. Think of it like a car with cruise control. It maintains a set speed, but the driver can accelerate if needed. ACV allows for patient-initiated breaths while ensuring adequate ventilation. Synchronized intermittent mandatory ventilation, or SIMV. This mode allows for more spontaneous breathing by the patient. The ventilator delivers a set number of breaths, but the patient can breathe on their own between those breaths. It's like having a backup singer who joins in at specific intervals, allowing the lead singer to take the forefront. SIMV is often used as a stepping stone to wean patients off the ventilator. Continuous Positive Airway Pressure, or CPAP. This mode provides continuous positive pressure to the airways, keeping them open and preventing collapse. Imagine blowing air into a floppy straw to keep it open. CPAP is often used for patients who can breathe on their own, but need help keeping their airways open. Pressure Support Ventilation, or PSV. This mode provides pressure support during inhalation, making it easier for the patient to breathe. It's like having someone give you a gentle push on a swing. It helps you move, but you're still doing the work. PSV is often used to support patients who are weaning off the ventilator. Setting up a ventilator is a meticulous process, much like preparing a patient for surgery. It involves a series of carefully orchestrated steps to ensure the patient's safety and the effectiveness of the treatment. Preparation is key. Before connecting the ventilator, the patient's airway needs to be secured. This might involve inserting a breathing tube called an endotracheal tube or a tracheostomy tube directly into the trachea. The patient's vital signs, including heart rate, blood pressure, and oxygen levels, are closely monitored throughout the process. Connecting the circuit. The ventilator circuit is a closed system of tubing that connects the machine to the patient. It includes a filter to remove bacteria and other contaminants from the air being delivered. The circuit is carefully connected to both the ventilator and the patient's airway, ensuring a secure and airtight seal. Initial settings. Based on the patient's weight, lung function, and blood gas analysis, the initial ventilator settings are determined. These settings include the tidal volume, which is the amount of air delivered with each breath, the respiratory rate, which is the number of breaths per minute, and the fraction of inspired oxygen, which is the percentage of oxygen in the air being delivered. Fine-tuning for comfort. Once the ventilator is up and running, the settings are adjusted to ensure patient comfort and adequate ventilation. This might involve tweaking the pressure support, adjusting the flow rate, or adding humidification to prevent the patient's airways from drying out. Setting up a ventilator is not a one-time event. It requires ongoing monitoring and adjustments to ensure the patient is receiving the right amount of support and to avoid potential complications. Section 5. Monitoring and adjusting. The key to safe ventilation. Just as a pilot constantly monitors the aircraft's instruments during a flight, healthcare professionals keep a watchful eye on a patient receiving mechanical ventilation. This vigilant monitoring is crucial for detecting any changes in the patient's condition and making necessary adjustments to the ventilator settings. The most basic form of monitoring involves simply observing the patient. The rise and fall of the chest indicate whether the patient is receiving adequate breaths. Changes in skin color, particularly a bluish tinge around the lips or fingertips, can signal a drop in oxygen levels. The patient's vital signs, including heart rate, blood pressure, respiratory rate, and oxygen saturation, are continuously monitored. Any deviations from the normal range can indicate a problem with ventilation. In addition to visual cues and vital signs, more sophisticated monitoring tools are used. Pulse oximetry measures the oxygen saturation of the blood, while arterial blood gas analysis provides a detailed assessment of the patient's oxygen, carbon dioxide, and pH levels. Based on the information gathered from monitoring, the ventilator settings are adjusted to optimize ventilation and ensure patient comfort. This dynamic process requires a deep understanding of respiratory physiology and the ability to anticipate and respond to changes in the patient's condition. The ultimate goal of mechanical ventilation is to wean the patient off the machine and restore their ability to breathe independently. This process, known as weaning, is a gradual and carefully managed process that requires close monitoring and collaboration between the healthcare team and the patient. Assessing readiness is the first step. The decision to initiate weaning is based on the patient's underlying condition and their ability to breathe spontaneously. Signs of readiness include improved lung function, stable vital signs, and the patient's ability to trigger breaths and cough effectively. Weaning is not an all-or-nothing proposition. Instead, the amount of support provided by the ventilator is gradually reduced, allowing the patient to assume more of the workload of breathing. This can be achieved by decreasing the respiratory rate, reducing the pressure support, or switching to a ventilation mode that allows for more spontaneous breathing. Throughout the weaning process, the patient is closely monitored for signs of distress, such as shortness of breath, increased heart rate, or a drop in oxygen levels. If the patient shows any signs of intolerance, the level of support is increased. Once the patient demonstrates the ability to breathe comfortably and maintain adequate oxygen levels without significant assistance, the breathing tube can be removed, a process known as extubation. Even after extubation, the patient's respiratory status is closely monitored to ensure a smooth transition to independent breathing. While ventilators are life-saving devices, they are not without risks. Complications can arise from the use of the ventilator itself, the presence of the breathing tube, or the underlying medical condition that necessitated mechanical ventilation. One of the most common complications is ventilator-associated pneumonia, an infection that can occur when bacteria enter the lungs through the breathing tube. Strict infection control measures, such as hand hygiene, oral care, and elevating the head of the bed, are crucial for preventing VAP. The mechanical forces of ventilation can sometimes damage the delicate lung tissue. Strategies to minimize this risk include using lower tidal volumes, adjusting the pressure settings, and providing adequate humidification. Prolonged exposure to high concentrations of oxygen can be toxic to the lungs. The goal is to use the lowest possible oxygen concentration to maintain adequate blood oxygen levels. Being on a ventilator can be a frightening and isolating experience for patients. Sedation and pain management are essential for comfort, and communication strategies, such as writing boards or communication devices, can help alleviate anxiety and promote interaction. By understanding the potential complications and implementing preventive measures, healthcare professionals strive to minimize the risks associated with mechanical ventilation. Managing a patient on a ventilator is not a solo endeavor. It requires a coordinated team effort involving physicians, nurses, respiratory therapists, pharmacists, and other healthcare professionals. Each member of the team plays a crucial role in ensuring the patient receives safe and effective care. Physicians, particularly critical care specialists, are responsible for the overall medical management of the patient. They make decisions about the need for ventilation, the mode of ventilation, and the weaning process. Nurses provide continuous bedside care, monitoring the patient's vital signs, administering medications, and providing emotional support. They are the eyes and ears of the team, alerting other members to any changes in the patient's condition. Respiratory therapists are experts in the technical aspects of mechanical ventilation. They are responsible for setting up the ventilator, monitoring its function, and making adjustments as needed. They also play a key role in weaning patients from the ventilator. Pharmacists ensure the patient receives the appropriate medications, including sedatives, pain relievers, and medications to prevent complications such as ulcers and blood clots. They also monitor for drug interactions and side effects. Effective communication and collaboration among team members are essential for safe and successful ventilator management. Regular rounds where the team gathers at the bedside to discuss the patient's progress and plan of care are an integral part of this collaborative approach. In the realm of critical care, where the fragility of life is starkly evident, the ventilator stands as a symbol of hope and a testament to human ingenuity. It is a bridge over troubled waters, a temporary lifeline that sustains life when the body's own ability to breathe falters. The journey of a patient on mechanical ventilation is rarely smooth sailing. It is a path fraught with challenges, setbacks, and the ever-present possibility of complications. However, amidst the complexity of tubes, machines, and medications, the ultimate goal remains clear: to restore the breath of life, to wean the patient from the machine, and to empower them to breathe on their own once more. This journey is a testament to the resilience of the human spirit and the unwavering dedication of those who care for the critically ill. It is a journey that underscores the profound impact of medical technology and the importance of compassionate, patient-centered care. And it is a journey that reminds us that even in the face of adversity, the breath of life, once restored, is a precious gift to be cherished.